Have you been told you have lazy butt syndrome? It's like an epidemic during a pandemic. So maybe you've been told your glutes don't fire, your glutes are inhibited, you have lazy butt syndrome, you have gluteal amnesia, or something like that. We want to take a look at the research into this proposed dysfunction, because today our goal is to answer, should I care if my glutes aren't firing, or is this even a thing? So the notion or the idea behind the glutes not firing and it causing pain is that it assumes that if the glutes don't do their role, some other body part will have too much stress on it. So if the glutes aren't working when you squat or run or lift your leg up, maybe your back gets overloaded or your hamstrings get overloaded, and that's why you have pain. And since the glutes are kind of the center of the body, that's why you'll hear it suggested that the glutes can influence all of these other functions and might be a factor in pain almost anywhere at a distance from your glutes. But what does the research say? So the big thing is there are no validated tests, which is pretty unbelievable because you have all these universities talking about this idea and all these great therapists, performing in this way. And yet there's not a single test that you can do in the clinic that's been validated to actually measure how excited or inhibited your glutes are. It's pretty unbelievable. So we do have biomechanical research or neurophysiological research instrumentation that can measure your cortical spinal excitability. It involves the brain and stimulating the brain, different parts of the brain. And we do have EMG or electromyography that can measure how excited a muscle is. It gives you the signal under the electrodes that you're measuring. So we do have stuff that you can do in the biomechanical lab. So let's take a look at some of that research. And when you look at the papers using EMG, we tend to see that when people are in pain, so when they actually have the problem, they tend to have more glute max muscle activity, right? Kind of the opposite of the hypothesis. So let's take a fast and furious look at this research. If you want, you can look at my blog titled, Have the Butt Muscles of the World Gone Silent? And that goes into some of this as well. So let's kick it off with some narcissism. This is my paper from 16 years ago where we had people lie on a table. They lift their leg up. We measure the muscle activity in their hamstrings and their glutes and their back muscles. The theory at the time was the glutes should be firing first. If the glutes don't turn on first, then they're inhibited, and that could be a problem for future, pain and injury. What we found was, and these were healthy young people, 20s and 30s, all of them had delayed glute max firing. The glute max was always the last to fire. So it was normal. What we were calling pathological was normal. And my paper was repeated by at least 5 other studies through the years. So it's been replicated that this is a normal thing. Luckily for me, my future wife, and this is legal because we weren't dating at the time, my future wife was in the group that we studied. I got to put electrodes, on her glutes and measure her muscle function. So I knew she was the one. And what happened when we were dating is she sprained her ankle really bad. And this is awesome because our theory at the time was if you have a distal problem, so a problem in your knee or your ankle, that might mess up the motor control in the glutes. And that leads to this gluteal dysfunction. So I was able to track her, over months to see what happened to her glute max activity. And nothing happened. That's what we found. I know it's just one person. You shouldn't base any ideas on one single case study. We do it all the time. But again, nothing happened with her. So it kind of questions the idea of whether or not you should care about glute max dysfunction or care about an ankle sprain influencing glute max dysfunction. All right, more research. What if you twist really hard? When you twist, you should be using your glutes, your lats, your rectus spina, your obliques. All these muscles work together. And what happens if you have low back pain? Well, your glute max, it works overtime. There isn't less muscle activity. There is more glute max excitation. The EMG is measuring more signal in the people who have low back pain versus the control group. Another paper, what if you lift up your leg and you have chronic low back pain? How does that change the glute max activity. Same thing, do we see inhibition? No, we don't. We see more activity when people have chronic low back pain. Has this been repeated? Yes, this has been repeated in this study here. Same thing. When people have low back pain, they have more glute max activity. What about hamstring strains, you ask? You bet. Lift your leg up. The glutes have to work, the hamstrings have to work, the erector spinae has to work. What do we see happens when people have hamstring pain? They have more glute max activity. Noticing a trend? What if you're pregnant, and you have low back pain? What happens with your glutes there? Well, same thing in this study. Pregnant people had more glute max activity when they lifted their leg up during a bird dog, right? This is a common theme. We're not seeing this generalized idea that inhibition is the norm or inhibition is this common thing that occurs. I'm not willing to say it never occurs. I'm just saying there's not a lot of evidence that it does, right? So this is more of like a zebra. If you see a bunch of horses, most of the things you're seeing are horses, not zebras. This is not happening a lot. Now, here's the other idea. Is it plausible? Do you care about having less glute max activity, or whether it's relevant to pain if your glute max was even inhibited? Or is this something that you can even tell? So my patients will tell me that they are concerned that they don't feel their glutes when they're walking, jogging, or during glute bridges, right? And they've been told that they should, and then they think that there's something wrong. My answer to them is really simple. They're normal. It's not uncommon to not feel your glutes when you're walking, jogging, or doing a bridge. During these tasks, there's not a lot of demand on the glutes. Why should you feel them, right? So it's kind of implausible to be worried about the glutes working a lot or not working at all when you're doing tasks that don't really ask them to work a lot. So we need to stop pathologizing normal sensations, right? We're making mountains out of molehills. We're creating dysfunctions where there aren't any. So let's look at some of these studies looking at glute max activity during a variety of tasks. If we look at this paper by Bartlett out of Roger Cram's lab, a great biomechanist, what do we see? Well, take a look here. So when people are walking, we see little spurts of the electrical signal, not really a lot at all. When people start to, run or jog, we see a little bit more activity, not that much. But we really see the glutes working when you're sprinting, and we see more activity when you're climbing, right? Or this could be like doing a deep lunge or a stepping up three steps, right? You got to go deep. You need heavy loads to really feel the glutes. So what about the glute bridge, right? It's a common test almost to see if your glutes are firing. And people will say, I just don't feel them working while they're doing a glute bridge. The thing is, you don't need a lot of glute activity when you do the glute bridge. We shouldn't even call it a glute bridge. It's just a supine bridge. So if you don't feel it, don't worry about it. So let's look at another paper, a different research group. What did they find? Well, if they did a glute bridge with one leg, they could see more muscle activity recorded with the electrodes, right? But the thing was, the glute bridge wasn't the dominant muscle that was working, right? It was the hamstrings that worked, and it was the back. So when someone says, oh my gosh, I just feel that glute bridge exercise in my back and my hamstrings, you again say, that's normal. You are a human. That's what you're supposed to feel. That is not a problem. Don't make the diagnosis that the glutes are inhibited based on normal findings. But can you train people to use their glutes more? Or can you modify exercises to get more glute activity? Yes, absolutely. If you do a squat and if you lean forward more at your hips, and shove your back out and push your knees outwards and grab the floor and try to spread the floor, that will train the glutes better. You'll get more of a glute response. Whether you need to do that to be safe, that's another question. So you can definitely get more out of your glutes. Right? But it's not necessarily a problem that you got less out of your glutes before. Right? So let's look at a paper here by Holman that tested this idea of cueing, different ways to move to try to get more glute max activity and get less hamstring activity. What did they find? People were successful. If you gave them the cues, squeeze your glutes, extend your knees, push into my hands, you could increase glute max activity. But the thing was, you also increased hamstring activity. During a supine bridging exercise, the cueing techniques did not selectively increase gluteus maximus recruitment while minimizing an increase in hamstring recruitment, right? That's amazing, and it makes sense. Right? What people were essentially doing was getting the glutes to work more, probably getting the quads to work more, and getting the hamstrings to work more. It's like me bending my arm here. Boom, I'm working my biceps hardly at all, right? But I can contract really hard, right? And then it's working. I'm definitely getting more bicep activity, but it means I'm getting more triceps and I'm working everything else around it. Is that a better way to do it? No, it's just a different way to do it. It's the same thing with the glute bridge, right? You can't really change the ratio, or at least no one has really shown that. The issue with testing like this, where we tell people, oh, I'm going to get the glutes to work more and I'm going to get the hamstrings to work less because I'm fixing this dysfunctional motor pattern, is that if you are a therapist or a patient, and if you now do the task with the cueing, you might be led to believe that you had an issue before, right? But you don't. You're just doing it differently. That's it. It wasn't pathological before. You just learned another way to do the movement. So let's wrap up and still be kind, because I know that people will disagree with this. And what I think we're disagreeing about is your clinical success. See, I know that you are helping people. If you see a therapist and they say, let's work your glutes for your low back pain, let's work your glutes for your knee pain, they're going to help you. There's a really good chance that you're going to get better. And then they're going to think, it's because the glutes were inhibited. The problem with that is we often get people better for different reasons than we think. A very good example of it is this paper here, where what they did is they compared glute max and glute med strengthening in people with knee pain, compared to another group that had knee pain, but they strengthened their hip adductors and their hip flexors. Both groups showed improvement, and there was no difference between groups, right? So it really challenges the idea of the relevance, or at least this pernicious, widespread problem of gluteal inhibition. So quick recap here. If you're in pain, don't blame yourself for thinking that you have a sleepy butt. It's really unlikely. If you've been doing glute exercises for months and it's not helping, well, that's good. You gave it a good try. Now maybe it's time to try something else. Work with your therapist, see someone else. There's other ways for you to recover. If you're in pain, if you have low back pain, you have hip pain, you have knee pain, and you haven't tried gluteal exercises, and you've just been resting and not doing a lot, well, then doing glute exercises, that's a great start. I hope that can help you. And sometimes, if you move differently and you use your glutes differently and you use your hips instead of your knees and that feels better, or use your hips more instead of your back and that feels better, then go for it, right? It doesn't mean you had faulty glutes before. It just means you stopped doing something that hurt and you moved another way. Yay, rocket science, all right? If it hurts to do this, maybe don't do that for a little bit. All right, but again, stop blaming the glutes for that. You're just moving differently. Okay, with that advanced wisdom, I'm out. Don't blame the glutes. Adios.